Counties want the national government to take over payment of salaries for doctors on study leave, saying they cannot afford to keep such medics on a payroll. A health task force constituted by Health Cabinet Secretary Cecily Kariuki is proposing a system of training where doctors will be trained in the counties they work for. This comes at a time when counties have been complaining about shortage of manpower at key hospitals. Now, Kakamega County will play host to this year's Mashujaa Day celebrations, and the celebrations will be held at Buhungu Stadium. Kenyans on October 20th celebrate the heroes and heroines who fought for the country's independence. Migori Governor Okoth Obado is expected in court this afternoon to know whether he will be released on bail or not. The rise in cases of insecurity in Topanga area in Kisauni constituency has led residents to take their hands into their hands. Now, residents say criminal gangs have been terrorizing residents late into the night. All right, welcome back to KTN News Center, where we bring you up to date with what is making the headlines. To our top story now, where central Kenya counties want the national government to take over payment of salaries for doctors on study leave, saying they cannot afford to keep such medics on the payroll. Now, the counties say they have had to pay doctors who are away for as long as 6 years. A health task force constituted by Health Cabinet Secretary Cecily Kariuki is proposing a system of training where doctors will be trained in their counties they work for. Now, this comes at a time when counties have been complaining about a shortage of manpower at key hospitals. So right now, I'd like us to cross over and speak to the KMPDU Secretary General, that is Oluga, just to tell us more about this whole uproar about doctors going for study leave. And Oluga, thank you so much for joining us here on KTN News Center. What is your take on the fact that counties now want the national government to take the responsibility of paying these doctors?
Thank you very much, Brenda, for and the viewers for this opportunity to clarify a few of the issues concerning training and on specialization for medical doctors, dentists, and pharmacists. As we have stated before, the counties would never have been able to to manage the health workers and so the doctors, because they took up the responsibility, but they did not know what it entailed. They did not know that training of doctors is part and parcel of practice of doctors. It's part and parcel of regulating quality of professionals and regulating the quality of health care that is given to every citizen that needs that care. So counties want to have their cake and to eat it at the same time, which is very dishonest. So first of all, let me say that the fact that counties are saying that the national government should take over the function of training is not new. That is already in the Constitution. Indeed, training as a function of health is part, as I have mentioned, is part of the regulation of standards and policies, and it's part of the regulation of not just the quality of the services, also the regulation of the quality of professionals. And that is already in the Constitution in the 4th schedule. So counties are not saying something that is new. What we have stated before is that counties are the same ones that are hindering this function from being taken over by the national government. Because a case in point are counties that are stopping doctors from going to school, and they are not even informing the national government. They are not even stating their challenges. For example, we have Kirinyaga County that has stopped salaries for doctors who have gone on training. They have not given them release letters. They have not told them that they have rejected their request. They have not stated what exactly, as Kirinyaga county they would want doctors to train in, and they are saying that they are not going to pay them. They have not even written for them letters that we are stopping your salaries. They have just stopped. So that is a county, those are counties that are rogue. There are a number of counties that are doing the right thing, but there are also a number of counties that at best are just becoming rogue. The best way to solve this problem, as we have stated time and time again, is that health workers and especially doctors will never ever be able to be managed by counties. This truth will stand even in 20 years' time, even in 100 years' time, because the training of specialists, for example, training of a neurosurgeon or a plastic surgeon cannot fit into the local needs of a county. It has to be something that is planned as a country, as the whole country. We have to do needs assessment as the country, not as a county, and that gives counties a burden. But it is important that counties are now realizing this, and for us, we are very happy that that counties themselves are stating that this function needs to go back to the national government. But training alone cannot go back to the national government, because training of a doctor is part and parcel of working as a doctor. There's no doctor that works without training. So it will be impossible for training to be taken over by national government without all the management for doctors being taken over by national government. So at best, counties should be advocating for a health service commission that is subnational and supra-county, so that they take a part in the management of healthcare workers, but then they solve all these problems, including the budget challenges that they have had with training for doctors.
Dr. Oluga, so are counties within their power to decline?
The counties are not within their power to decline. They are just becoming rogue to decline. There are some few people at the county level, either at the governor's level or sometimes even chief officer, like in the case of Kirinyaga, a chief officer that thinks that he is God. And for us as a union, we have tried to really to restrain ourselves from acting hastily on this kind of cases. And we've given counties a lot of leeway to also choose and to also state what exactly they would want doctors to do. And we have advised our doctors that they engage their counties in an amicable and dialogue-oriented manner, so that they find a balance between the needs of the county and the needs of the doctors. But there are counties that are having a all or none policy. They will not train, they will not release, they will not pay. Those counties, we as a union are going to take very stern action on them. And I'm mentioning specifically Kirinyaga and a few other counties that are going to follow in that route. We are not going to hesitate to take action, and that action may follow complete closure of some of those hospitals, because, you know, where we have engaged counties and we are saying we want to dialogue, and we have said that let's get to an amicable solution. Like in Kirinyaga, there are 8 doctors that were admitted. Kirinyaga is one of those counties that had a doctor, a doctor chosen to study neurosurgery. Only 2 in the country, but they are stopping those kind of doctors. We are not going to hesitate to take action on them, and that action is going to be very, very stern.
Dr. Luga, is it the entitlement to get this training?
Yes.
Are doctors entitled for this training?
Doctors are entitled to get training. I know it sounds bad if I say it like that, but yes, the absolute truth